Hi, this is Dr. Finley. I'm the Chief of Vascular Surgery at Metropolitan Hospital. I'm making this video to try to address some of the concerns that many surgeons have who are not used to dealing with PPE, with volunteering in this crisis. I'm going to specifically talk about donning and doffing, but more importantly, unlike a lot of videos that talk about this, I'm going to try to address some of the issues that people have with how do you protect your family when you come home after volunteering, and how do you get between the hospital and coming home. I presently am helping to run the COVID unit at Metropolitan Hospital, and so I'm exposed to a high level of the virus, and so I'm going to give you some of the tips and tricks that I use to make myself feel comfortable and my family. So first I want to talk about getting to the hospital. So first thing you want to know is that I try to take as little as I can with me to the hospital. So I actually wear scrubs, something that I can easily wash multiple times and not worry about it. Number two is that I don't wear a watch. I don't wear any kind of jewelry or anything that I normally have on. I bring the minimal things that I can bring. I bring a set of keys, which I even took off everything but what I absolutely need. And I bring along my ID, which I actually detached from its pull chain with other IDs. So I just have this one ID, which makes it easier to sterilize it. When I'm on the street and walking to work, I do not wear an N95 mask. I think it's important to know that you don't need an N95 mask, but it's actually, what's more important to understand is that it's actually detrimental to wear it. Because we're trying to preserve the N95 and you may have to use it more than once, you break down the integrity of the mask the more times you wear it. So the metal that's in the mask is actually weakened with each time that you use it. And also literally the fabric and the seal that you get on your face is weakened with multiple uses. So it usually can only last about a week. So when you're on the street, what's really important is the mask's function is not to prevent you from getting aerosolization of the virus from other people. It is meant to be a reminder not to touch your face. Remember, the virus is transferred by your hands touching droplets that have contaminated surfaces. Then you touch your eyes, your nose, or your mouth. That is pretty much the only way you can get it. Aerosolization is actually very uncommon, and we'll address that when you're in the hospital. So a regular mask or even a scarf, and that's why they're talking about you can even wear a scarf, it's more a reminder not to touch your face. As far as aerosolization, that's what social distancing is about. That's why we're telling you to keep it social distancing. So if somebody sneezes or coughs, there may be some small amounts of aerosolization, and by having about a 6 feet distance, or in Europe it's 2 meters, that should relatively protect you. So I go to work with a regular mask. Upon entering the hospital, I bring a brown paper bag containing my N95 mask in it. When I come into the lobby, because I feel that the hospital is a different situation and that the risk of being exposed to the virus is higher, I switch into my N95 at that point. So what I'll often do is I'll go over to the Perel dispenser or I'll wash my hands. I'll take off my regular mask, put it in my pocket, because again, we're assuming it's not contaminated, and I will withdraw my N95 mask. Now, the important thing to remember is that you've just washed your hands, or you put on gloves or whatever you have available. But the important thing to remember is that you want to try not to touch the inside of the mask. Theoretically, it is the outside of the mask that's contaminated and the inside is sterile. So you want to open up the mask, and you can use your hand because you're only touching the outside, and you form it to your face. And then you take the 2 straps. One strap should go at the top of your head, and the second strap should go at the nape of your neck. You then want to make sure that you have a good seal, and you do that by breathing in and out, and you should see the mask move in and out on your face. And that tells me that I have a good seal. Now I will wash my hands again or put Perel on them again, and I will head into the hospital. Now, what I personally like to do is when I take the Perel, I'll leave it kind of wet on my hands, and I'll use that hand to get me to the men's locker room and to get my scrubs. So with a little bit, and I'm going to remove my mask right now to just talk about these things so I can make sure that you can hear me. So I head up to the locker room, but I have a little bit of Purell on my hands, and what I do is I use that hand to touch doorknobs, to touch elevator buttons. This is not official, but in my feeling is I'm helping actually to help sterilize the very things that are one of the leading causes of transfer of the virus, and also helping to keep my hand relatively sterile. So I get my scrubs and I go to the locker room. Now I want to change out of my clothes with my N95. You can either remove your N95 and set it aside, but that's more involved. You got to wash your hands again. You're touching the mask again. What I like to do is I put on my scrubs with the N95 in place, just trying to be careful not to touch the scrubs to the outside of the mask. But honestly, even if it does, you're going to be washing your scrubs. You're going to be, getting rid of the scrubs, and if it's touched your body, you're going to be showering afterwards. We'll address all that at the end. So now that you're in your scrubs with your N95 on, you head to your designated area. And this is where we're going to talk about donning. Now we're ready to don. We're in our designated area to put on our PPE. So I've come with my N95 in place. You want to, when you first get to the area, of course, you want to wash your hands again. The first thing that you want to do is you want to place on a surgical mask over your N95 to help protect the N95. Remember, a lot of this is about protecting this most important mask for reuse. So I place this over the mask, making sure I get as much contact as I can. The next step is that you want to put on your gown. The gown, you want to try to not touch the mask when you do it. I put it on the back of the head and bring it over, and then put your hands through and put your thumbs into the openings on either side. Then you want to secure it in place. Next, you want to put on a face mask. So some people say, is goggles better or is a face mask better? Goggles are actually better if you have true large amounts of aerosolization, because it can get around a face shield. But honestly, with what you're going to be doing, you're not really going to be exposed to those kind of levels. That's more about doing anesthesia and having, trying to intubate patients. That's where you get large amounts of aerosolization. The added benefit of a face mask is it's reusable. Well, so is the goggles. But more importantly, it actually helps to protect this mask also at another level. So you place the face mask over. The last step is you want to put on your gloves. Make sure that all the surfaces are covered. And you're ready to go. So now let's talk about you finished your shift and you're ready to doff. The important thing is to remember that you're trying to sequentially remove the things with the least contamination. So the first step is you want to move your gown and your gloves. I treat them as one piece. I would not take off your gloves and then take off your gown. What's better is you hug yourself, grabbing the gown and tear it away. As you tear it away, you want to kind of roll it up. So I pull it off, and as I roll it up, I kind of peel off my gloves from the inside of the gown, so I'm not to contaminate the rest of it. And then I take this to the trash and I discard it. I then wash my hands and I put on a fresh set of gloves. And now I remove my mask from behind the mask area. So you want to try to stay away from where it may be contaminated. I remove it, and either this is discarded. If you're reusing it, you take a Clorox wipe or whatever wipes that they have, and you clean the inside first, and then the outside, and you place it in a brown paper bag. The next step is you want to remove your outer mask, and this is to be discarded. That goes into the receptacle. You're now left with your N95. The last step is you peel off your gloves, you discard those, you wash your hands again, you now head to the locker room. So now you're in the locker room, you're ready to get back into your street clothes. This is actually an area that I think brings a lot of consternation to people, is that they're worried about how to transition from their scrubs to what they're wearing to go home without contaminating it. So the first step is, remember, you're trying to preserve your N95. So upon entering the locker room, I Purell my hands or wash my hands again. And then if I have gloves, I can put them on. But I want to remove my mask, and I want to be in an uncontaminated area in the back. So I remove my mask from the back, being careful not to touch the inside, and then place that in my brown paper bag. I then want to wash my hands. And then after I wash my hands, I'm ready to remove my scrubs. Now the first step is I need to take out the items that I brought with me. So I put my iPhone actually in a Ziploc bag because you have to have your phone with you. And the good news is your phone works perfectly fine through the plastic bag. I open that up, remove it, and I place it into a bag to take it home, a separate bag. And this can be plastic because I'm gonna be decontaminating it when I get home anyway. And I discard that Ziploc. I also take my ID and I put it in that same bag with my phone. Now I remove my scrubs, trying to be careful not to drag my scrubs across my face, obviously, because we're trying to protect this area and we don't have a mask on right now. So we take off our scrubs. What I like to do is I invert them onto the floor so I can stand on them, theoretically, if the floor was contaminated, but really the risks of the virus being on the floor is very low. But I'll stand on top of my scrubs and I'll put on my street clothes. Once I have my street clothes on, I go and wash my hands again, and then I place on my face mask. So now with my stuff in the bag and my brown paper bag with my N95, I head out of the hospital. Obviously, I wash my hands again on my way out. If I can get a little Purell or leave it wet, just like I already said, to use to close doorknobs, push elevator buttons, and I can head out. So I've arrived home now, and I want to transition from being outside to coming inside. This again is an area that brings a lot of people concern. Hopefully I can help with that. So when I get home, I assume that I'm still semi-contaminated. So the first thing I want to do is that if you have an outer area or you live in a home where you can go into the garage, I remove my shoes, and I have a trash bag waiting for me. If you live in an apartment and you don't have an outer area, then just have the trash bag near the door. I then strip down to my underwear and put all those items into the bag and close it and leave it there. I then take my personal items, which came in the bag, and I have a UV light box, which I got on Amazon, which are pretty inexpensive, where I place those items in here, which can sterilize them. Remember that the light only sterilizes the areas that the light can see. So often I'll do one side and then flip it and then do the other. If you don't have a light box, not a big deal. Clorox wipes or whatever it takes, you can just go over these items. Not a big issue. I then clean my hands with Purell or whatever I have. I usually keep Purell out in that outer area or near the trash bag. And then I go and take a shower and wash all the areas that may have been exposed, which especially the forearms because of your scrubs, your hands, your face, your hair, all those things. Once completed, I then go back and I get the trash bag and I evert it into the laundry machine and wash those. And then I also sterilize the phone and the ID if I don't have a light box. And that's it. You should be good at that point.